If you're tired of misinformation and want data that respects the lived experiences of people with autism and intellectual disabilities, stay with me and share this because science deserves a voice louder than fear. Robert F. Kennedy Jr. recently claimed that autism is preventable. That's not just wrong, it's dangerous. Because every time a public figure promotes that idea, we lose sight of what really matters: inclusion, support, and science. Today, we're unpacking 5 key statistics from recent research that paint a very different picture, one rooted in data, not dogma. These stats aren't cherry picked, they come from sources like the CDC and the AICC and peer reviewed meta analysis. And these reports tell a story that RFK Jr. is leaving out, one about the complex truth of autism and intellectual disabilities. Stat 16: autism diagnoses are rising, but that's progress, not a problem. As of 2022, the CDC reported that 1 in 31 children aged 8 years had been identified with autism spectrum disorder, or ASD. That's about 3.2% of kids, the highest rate ever recorded by the Autism and Developmental Disabilities Monitoring Network. That's not a sign of some public health crisis. It's a sign that we're finally seeing kids who were missed before. The increase in autism identification was especially strong among Asian or Pacific Islander, Black, and Hispanic children, who are now more likely to be diagnosed than white children, a pattern that only began to show up in 2020. For decades, these groups were severely underdiagnosed due to bias and unequal access to healthcare. The CDC also found that these same children were more likely to have co-occurring intellectual disabilities, highlighting just how deep those healthcare gaps have been. We weren't seeing these kids before because the system wasn't built to catch them. Here's another bright spot. Autism is being identified earlier than ever. Kids born in 2018 were more likely to receive a diagnosis by age 4 than kids born just 4 years earlier. That's huge because early intervention opens doors for better support, communication, and long-term outcomes. Let's check out the interpretation from the CDC on this report. Increased identification of autism, particularly among very young children and previously underidentified groups, underscores the ongoing need for equitable diagnostic, treatment, and support services. That's a big deal because when people like RFK Jr. say autism is a modern invention or a preventable outcome, they're ignoring the reality that our diagnostic tools are finally catching up to the people who needed them the most. It's not a spike, it's justice, it's awareness, it's inclusion. Stat 17. Autism is mostly genetic. It's not caused by vaccines. Let's talk about where autism really comes from and what it absolutely does not come from. First, the science. A massive study published in the Journal of the American Medical Association, JAMA, found that 83% of the risk for autism is inherited. That means most people with autism are born with it because of how their DNA is built. It's kind of like being born with brown eyes or curly hair. You don't catch autism. It's part of your brain's natural wiring. That doesn't mean one gene causes autism. It means there are hundreds of tiny genetic differences that shape how the brain develops. But that's not the whole story. Scientists also study environmental factors, things that happen before or during birth, like premature birth, complications during delivery, maternal infections or diabetes, lack of oxygen at birth. These factors don't cause autism by themselves, but in combination with genetics, they may slightly increase the chance that a child develops autism. Now let's talk about vaccines, because this is where people like RFK Jr. misled the public. You may have heard about a girl named Hannah Poling. She was at the center of a big news story in 2008 when her family got money from the Vaccine Injury Compensation Program. And some people thought the government admitted vaccines cause autism. But that's not what happened. According to the New England Journal of Medicine, Hannah had a rare genetic condition called a mitochondrial disorder. This means her cells had trouble making energy. After she got a group of routine vaccines at 19 months old, she developed a fever and became very sick. Doctors said the vaccines may have triggered her condition, which caused brain inflammation called encephalopathy, not autism. Headlines made it sound like the court ruled that vaccines caused autism, but they didn't. In fact, the legal language clearly says the vaccines aggravated her mitochondrial condition, not that they caused autism in healthy children. So, what do we take from that? Autism is mostly genetic, it's not caused by vaccines. The Hannah polling case is not proof otherwise. It's a very rare situation that has been widely misunderstood. We now have decades of research and millions of children studied, and none of it supports a vaccine autism link. Instead of blaming vaccines, we should focus on supporting people with autism, making healthcare fair and accessible, and stopping the spread of misinformation, because every time someone claims autism is preventable, they're spreading fear, not facts. Stat 18. People with autism and developmental disabilities face serious health disparities. While debates often focus on the causes of autism, it's crucial to address the pressing issue. Individuals with autism and other developmental disabilities frequently encounter significant barriers to accessing quality healthcare. Research indicates that people with intellectual and developmental disabilities, or IDD, are more than twice as likely to die prematurely compared to the general population. They also experience higher rates of mental illness, obesity, and other health conditions. These disparities are largely due to inaccessible health promotion and disease prevention services rather than the disabilities themselves. Individuals with autism and IDD often face. Barriers to healthcare access individuals often face inaccessible medical facilities, and that means maybe a lack of adjustable exam tables and diagnostic equipment not tailored to their needs. Communication challenges. Healthcare providers may not be trained to effectively communicate with patients who have cognitive or sensory differences. Limited preventative care. Routine health screenings and preventative measures are less frequently administered to this population. These barriers contribute to increased emergency room visits. Due to a lack of regular care, emergencies become more common. Higher hospitalization rates. Conditions that could be managed with proper outpatient care often escalate. There is a need for inclusive healthcare. To address these disparities, it's essential to train healthcare providers, equip them with skills to communicate and care for individuals with IDD, adapt medical facilities, ensure they're all accessible and accommodating to all patients, implement inclusive policies, develop healthcare policies that recognize and address the unique needs of the IDD community. Stat 19. Employment gaps for people with intellectual disabilities are still huge. Let's talk about what happens after school for people with intellectual disabilities, because the reality is most of them are shut out of the workforce. A major national study found that only 44% of adults with intellectual disabilities are even in the labor force. That means working or trying to work. Compare that to 83% of adults without disabilities. That's nearly double. Now, here's the hard truth. Just 34% of adults with ID are actually employed. That's only 1 out of 3 people. And even for those who do have a job, most are underemployed, meaning they work part-time or even below minimum wage, often in sheltered workshops instead of inclusive settings. And among those who are looking for jobs, the unemployment rate is 21%. That's more than twice the national average. Let's be real. This isn't because people with disabilities aren't willing to work, it's because employers don't always understand their value. Interview processes are built for neurotypical norms. Job supports like coaching or accommodations are hard to get. And here's the kicker. Most people with ID who do get hired stay in their jobs for years. We're talking serious loyalty and long-term commitment. They just need someone to give them a chance. This isn't just about employment, it's about dignity, independence, and equity. If we really want to support people with developmental disabilities, then we can't just talk about inclusion, we have to build workforces that include them too. Stat 20. Most autism research money isn't spent on services or support. Let's wrap this up by looking at how autism research dollars are actually spent. In 2020, the United States spent over $418 million dollars on autism research. That sounds like a lot, and it is, but where it went tells a very specific story. According to the Interagency Autism Coordinating Committee, 45.4% of that money went to studying biology, things like brain scans, genes, and the underlying science of autism. Now compare that to areas that actually impact daily life. Only 8.4% went to services and supports. Just 4.3 went to lifespan issues, like helping adults with autism navigate housing, healthcare, or employment. And 7.1% went to improving screening and diagnosis. That means more than half of all autism research money went to studying what causes autism, not what helps people who live with it. And here's the thing: researchers agree that understanding the brain is important, but autistic people and their families are asking for practical help, not just lab results. Even the IACC acknowledged this in their 2024 report. They said we need to grow funding in areas that have been overlooked, especially new ways to support people on the spectrum and fund organizations focused on real world impact. So when we talk about supporting autistic individuals, let's follow the money, because right now, most of it isn't reaching the people who need it the most. This isn't about fear, it's about facts. Here's the bottom line: autism is not preventable, and pretending it is distracts from the real work that we still need to do. We've looked at the data, we've shown autism is genetic, vaccines don't cause it, people with autism face massive health and job barriers, and the research funding still isn't meeting their day to day needs. So when public figures say things like autism is preventable, what they're really doing is taking focus away from the actual support autistic people need right now. If we want to help autistic individuals thrive, we don't need a cure. We need inclusive schools, fair healthcare, equal job opportunities, and real respect. Let's stop chasing myths. Let's start showing up for people.